Hey, everyone. It's Bill Brandmeier. I'm here, co-host of the Movement is the Medicine podcast. So great to welcome you back. Movement is the Medicine is the idea that we need to move our bodies to have a better, healthier life. This is our 6th episode. We just keep adding on these great guests one after another. If you haven't seen our other episodes, we've highlighted some young athletes, some athletes that are just coming into their own, ready to make the mark on the professional leagues. A former NBA champion has been on our show, and then a veteran of Olympic sports training out of Australia who just kind of rocked our world in our second episode. And Doug and I have really come in and enjoyed this whole experience, right? And
it's been amazing.
We keep telling ourselves we're just trying to get better, trying to get good at this. But it's been a really fun opportunity for us, and we're so glad that you joined us today. And we're excited to bring on our first local Kansas City guest, and it's Jay Roberson, right?
Roberson.
I did that on purpose. Part of Children's Mercy Hospital Sports Medicine Department. He is an orthopedic surgeon. He has spent years at some of the top institutions in the country, and we are so lucky to have you here in Kansas City. I'm not trying to build you up in any way, but I do want to welcome you and tell you how thankful we are that you made the trip out here to be live with us, and that I'm just honored that I get to be able to call you a friend. So welcome to Movement is the Medicine.
Well, thank you guys for having me. I really appreciate it.
You're welcome.
Thanks
when you
for coming
first
down.
heard that we were doing this, you didn't know Doug at the time. You just heard that I have started this podcast, Movement is the Medicine. I'm curious as to, what your thought about it. Like, oh, yeah, this guy's doing this podcast. What's it going to be like? What were your thoughts when you first heard about this?
Well, I figured you were going to do a great job with it. I knew that. But, I thought, that sounds like something we could be a part of. Children's Mercy, sports medicine, the KCPA plan that we've both been involved with. Those are some of our big goals, is to get kids moving, and the adults, that's important too. I want them to move as well. But being at Children's Mercy, our focus is a little bit more on the kids. But I thought it sounded like a great idea, and I'm just really happy to join you guys.
Well, this is great. We're going to get into the Kansas City Physical Activity Plan. The Kansas City Physical Activity Plan is a citywide, comprehensive, strategic approach to getting our city more active and getting our city moving. And it's a fully cross-sector. There's 10 sectors that work together to try to find ways to get Kansas City more active. And Jay sits on as the lead of the healthcare sector, and I'm on the sports sector. So that's how our paths cross, right?
Absolutely.
And from the moment we met, we kind of knew that we had this in common. I think early on I did a symposium. I was able to talk with Kevin Latz. He's part of your group, right?
Mm-hmm.
Dr. Latz is just amazing, orthopedic surgeon, leads the orthopedic surgery department at Children's Mercy, and he's one of the guys who just gave me more and more confidence that we have one of the top sports medicine pediatric care setups in the country, and we're recognized as that, correct?
Yeah.
Tell us a little about the accolades of the department and where you kind of fit, and what's been your sense of Kansas City's growth in that area since you came on.
Yeah, it's been pretty explosive growth. It's been about 12 years now that we've actually had a sports medicine department at Children's Mercy, and I was the second non-operative sports medicine doctor hired. Greg Canty and Kevin Latz kind of started it together, Kevin being the surgical side and Greg being the non-operative side. Back in 2010, 11, he started working on that. And man, it's just grown by leaps and bounds since then. It started off 2 physicians. Donna Pacheco was also one of the surgeons at that time who was doing sports medicine. 1 athletic trainer, 1 physical therapist who was really focused on sports, and now it's totally different. We've got 25 athletic trainers at 25 schools, plus some clinic athletic trainers. We've got a whole physical therapy department. I think about 14 sports certified physical therapists. We've got 4 non-operative physicians. We've got 2 surgeons. We've got a nurse practitioner. We've got 4-person nursing staff. So it's a big group, and it's all pediatrics. So everybody's been trained in pediatrics specifically. So that's where we're unique in the city.
And you have placements all over high schools and in sports leagues throughout the city too. So you have this. There's a strategic approach to this.
Yes. So we cover The 25 schools we cover are all over. So Kansas and Missouri side, different school districts. And then our locations, we have locations at 135th and Metcalf. That's our Blue Valley location. That's where I'm at most days of the week.
Okay.
We've got Village West, which is out in Bonner Springs. And that's the combination Sporting Kansas City, U.S. Soccer, and Children's Mercy facility, really world-class facility. I mean, people tour it to figure out how to make their place better when they're building it. We've got downtown. We've got Children's Mercy, the shining beacon on the hill that everybody knows of. We've all got Children's Mercy East, so out in Independence, off 70 and right off 470. And then we also have the Northland Clinic. So that's a multi-purpose clinic. So there's other specialties there besides sports medicine as well.
Well, Doug, I want to bring you in. When you came to Kansas City, did you recognize that Children's Mercy was what it is? Was it something that you've learned since you've been here?
I did not know it was such an expansive group. So, I mean, it's really exciting. Of course, with, my involvement with the projects I'm working on, we knew, Children's Mercy because of the sponsorship with Sporting KC. And it's such a small world because I was at the Sporting KC facilities talking with Kurt and Joey, the sports medicine director and sports scientist there. We're collaborating with them. And that's where I met Jay. And it's like, and Kurt introduced us. And it's such a small world. I had no idea you knew Bill. Yeah. But I knew Bill was doing an event later in the day. And you're like, I'm going to an event. I'm like, oh, you might meet Bill. You're like, I know Bill.
I know Bill.
So, like very small world. Right?
Yeah. And you said your wife went to Shawnee Mission East, right?
She went to Shawnee Mission East.
That's where I went to.
And I went to East, too. So we're Lancers. Lancers we will always be.
Lancers, too.
Excellent. That's great. I wore a Lancers T-shirt for a while.
It's a good T-shirt.
So that's the idea of pediatric sports science. Let's talk a little bit about that field, because you said it's exploded. It hasn't just exploded here, right? There are sports injuries that are going on throughout the country. Kids are injuring themselves in ways that never before. They're stressing their bodies in ways that never before. And it's a problem, right? I mean, it's a real serious national issue.
Yeah. I mean, there's your traditional aches and pains, but then you got your sprains, your little bit bigger injuries, your fractures, lots of fractures in kids, more than adults. But then we get kids having a lot of the ACL tears and the overuse injuries and things that are related to fatigue and overtraining and probably poor body movement and things like that have kind of compounded over the years, especially with the intense kind of sports specialization that's going on. And so, I mean, we see a lot of the traditional pediatric injuries, but we see some adult type injuries in kids as well. Yeah. Pretty young.
I'm tempted to go down this path, and I think we'll get there. And I don't want to put you on the spot, but there are a lot of problems that are happening in youth sports. But Doug, from your background and your expertise, when did you start realizing that this adolescent, overuse, these injuries, was it during COVID, before COVID? What was your relationship with it?
Yeah, well before COVID. I think I had always been aligned with medical systems. Hospital for Special Surgery in New York, Kessler Institute for Rehabilitation, which is also a New Jersey rehabilitation-based hospital, but they have outpatient services. And from the time I was first entering, my professional journey, you'd see those kids come in there, and you bring up a great point. I mean, back then, 25 years ago, the specialization leading to repetitive stress injury, right? And we were talking about that last week, Bill, with the cumulative stress, isolation into one event. Not only is it the physical injury, but it leads to, compounding, burnout, or maybe, disillusion with what they're doing, right? So, right.
Well, so there's a right way to do this, right? I mean, the whole idea is to promote physical activity and exercise. We're not trying to tell people not to give their kids sports experiences or have their kids go practice or do repetitive workouts, things that we know are good for them. But there's a right way to do it, right? Yeah. Talk a little bit about the positive parts of physical activity and exercise and how we don't want to rob our kids of those experiences, coupled with protecting them from preventing infection. I say preventing injury. Yeah.
Well, I mean, we all know sports are fun. That's the most important thing. I think that gets lost in the weeds sometimes. The sports are fun, and that's why kids do it. The number one reason kids check on their survey for doing sports is because they want to have fun with their friends. It's not to be a professional athlete. It's not to get a college scholarship. It's not to make money. It is to have fun. Those other things that I just mentioned, those are like 15, 16, 17 on the list of 20 questions.
Right.
So kids know why they want to do it. Sometimes adults get in the way. So that's really probably the right way to do it is let kids do more sandlot stuff. We know that probably not going to get back to that. That's going to be hard to get back to full sandlot kids just kind of organizing themselves. So we're an organized society. People have time constraints. It's going to happen like that. But what we need to do is make sure people are aware that their kid doesn't have to play the same sport year round to get good at that sport. In fact, they would actually benefit from playing other sports in a lot of different ways. It helps their movement patterns. It helps them kind of change things up. It gives them skill transfer. So Australia, I don't know if your guest a couple weeks ago talked about that, but Australia is like king of the world in skill transfer. They get kids to try a lot of different things, and they figure out what they're good at later. Right. So they get that kind of, they specialize later in high school, in college, whatever. In the Olympic level is when they specialize. So, but there are some places where early specialization can be beneficial and is almost kind of necessary, like gymnastics and figure skating, some of those sports that you really are hitting your peak at a really young age. And most people aren't going to go into those things. So that's, I think, a very unique group and doesn't apply to most of our athletes that we're talking about.
But inherent in those specialized sports like that, dance, things like diving, gymnastics, they tend to have more injuries.
Mm-hmm.
Those I know my daughter's a dancer. She injured herself every other year. It seemed like she was hurting her foot or her knee or
Gymnasts are the toughest of all the athletes. Just to be clear, gymnasts and wrestlers, they're the two toughest athletes.
Right.
The gymnasts, they don't let you know they're hurt until 8 months later.
Well, and this multi-sport theme has kind of been a part of almost every show that we've had so far, Doug.
Right, yeah. All of our guests.
Yeah, exactly.
Really. Right, the NBA champion down to the gentleman who's just drafted by the MLS. All multi-sport athletes coming up didn't specialize until they were a sophomore in high school, junior in high school, and that's when they had maybe a talent to exceed in that area. So, right.
I know recently you kind of got behind an initiative to get Children's Mercy Hospital to be the first hospital in the nation to recognize and sign on to the Bill of Rights, the Young Athlete Bill of Rights. Is that the title?
It was the Children's Bill
of Rights.
Yeah. Actually, HSS did it before us. We're the first children's hospital to sign on.
Okay.
HSS.
That's fine.
Good hospital.
But it's a national initiative. It's signed on by some of the top advocates and stakeholders within the youth sports community, and it's all built around 9 different things that are required for a young person to have a successful experience with sports. And it starts by making sure that kids are involved and have access. In your experience with your side of orthopedic, pediatric care, sports medicine within the Children's Mercy and at Baylor and at Florida, have you seen some of these access barriers come to play in terms of the ability of certain athletes get the care they need and certain athletes don't, and certain athletes are getting the opportunity, certain athletes don't? Talk a little bit about, just from your expertise, you're kind of, you sit at a special, unique place of viewing it. Talk a little bit about access to sports for kids.
Yeah, I mean, one of our goals at Children's Mercy is to get every kid who wants, or every family who wants to get in seen by us, seen quickly. But the ability to navigate the healthcare system, which is way overly complex, is easier for families with resources, with time, with the ability to take off work and get their kids somewhere where they won't get fired or won't lose their job or just lose out on pay for the day. That is easier for families with resources. And in Kansas City, there's a contrast for sure. We're actually working on an implementation strategy right now for ACL care, figuring out ways to break down barriers for families to get into Children's Mercy and get the care started sooner so they can get back to play sooner, so they can get the proper rehab, so they can hit every step of that just if you hit every step of the whole thing a week sooner here and there, you're going to be better months sooner. So that's one of the things we're really working on, and we've got an initiative, a grant to study it and kind of figure it out. But another thing we're going to try to do is create sort of a student panel. So get the kids to come and talk to us and tell us what they think would help with getting care faster or getting care in a better way or an easier way. Things we would love to do. There's many barriers to it, but be able to kind of meet kids where they are and do more stuff at the schools, evaluating them, or at least getting maybe an athletic trainer to be able to facilitate a kid via Zoom, via telehealth visit, and get that kind of initiation of the whole process started a little bit sooner. So,
well, sounds great.
Well, one of the things I've always been impressed about you is your thoughts about preventative strategies. And as the sports sector lead of the Kansas City Physical Activity Plan, you have led one of the strategies into helping pediatricians and physicians recommend physical activity as a way of preventing injury and preventing mental health issues. And it's been harder than you would think to get physicians to prescribe physical activity. Can you talk a little bit about that issue, and why is it so hard to get a doctor to just make that part of their recommendations to a family?
Yeah. I mean, it all comes down to time on many levels. So one of it is time just while you're learning. So in medical school and in residency programs, unless you're going into orthopedics or family practice does a pretty good job of it. But most other specialties don't really focus on much musculoskeletal care. And it doesn't have to be, you don't have to know how to replace an ACL or reconstruct an ACL when you come out of pediatric residency. That makes no sense. But you should have to know kind of the basics of physical activity, how to encourage kids to get more physically active, how to hand resources to a family that can get them involved in more sports or just movement. It doesn't have to be sports. I think sometimes we get hung up a little bit on sports.
I agree.
But we all love sports. That's why we talk about it. But movement is movement.
Yeah.
And if you do it with friends and you're just playing rec or you're playing elite or whatever, you're moving. But that is kind of one of the big barriers, is just educating the doctors on the proper physical activity. I mean, it's just not a primary focus of curriculum. We're trying to make it that way. KU Med and UMKC Med School are both actually actively working on incorporating lifestyle medicine components into their programs. And a big chunk of that, 1/6 of that, is physical activity and being able to teach families and patients and kids about how to move better.
That's great.
Right. That's great. Yeah, I mean, so many wonderful things said there. And I think that's where it kind of segues into maybe my professional engagement with a client or a patient, is prescribing that level of activity, whether they're coming in from a post-surgical procedure or coming in with a repetitive stress injury, getting them past the phase of acute trauma, subacute, and getting them into early movement patterns that are going to facilitate an accelerated growth, right, and functionality. So, and I think the concept of prescribing exercise is something that I live with on a day-to-day basis, and periodizing that and structuring it so it's progressive and it's challenging as they're evolving either from an injury or even in a preventative kind of environment. So, yeah, I love that. And I think anywhere where that can actually become, more widespread, I think is an advantage for the young athlete, right? So,
have you seen some movement in that area? I know it's a strategy, right?
Yeah. So changing the curriculum at the actual schools is kind of our basic level. But what we also want to do is incorporate the allied health fields too. So we want pharmacists to be aware of this. We want nurse practitioners, nurses, physical therapists. Sometimes, they know about how to fix an injury, but they don't always know about just getting people moving. Athletic trainers, getting them involved. So trying to get every piece of the whole medical system focused on that, because that will reduce healthcare problems for the whole entire population.
Yes, no doubt. Well, it's funny because it's in a way it's kind of what I'm trying to do, is change the system with the coaches and the parents, just to get them to understand that it isn't all about winning on the field and get my kid into the elite training and drive my kid to wherever he needs to go so that he gets whatever he needs and put him on a travel team. And it is just about getting kids together in a community, social connections, the fun of being together, free play, like you said, sandlot games. And we've kind of closed our minds to that. It's like we've lost ourselves in this whole world of drive and move and win, and I'm fighting it. And it's so awesome to be on this group of Kansas City Physical Activity Plan sectors and have people on all sides think about this in a way that's kind of new and refreshing. I'm not sure if it's going to go anywhere. We've been working on it for 4 years, and I don't think anybody knows what we're doing. Now it's called Move Together KC. If you want to find out about it, go to movetogetherkc.com. You'll learn all about everything we're trying to do to help Kansas City become more physically active, because we believe movement is the medicine, and that's, we need doctors to believe it, and we need pharmacists to believe it, and we need the moms and dads and the coaches and the league, the people who run these leagues, and everyone. I don't mean to be preaching, but
right.
But I guess I do.
Right.
Okay, so I kind of want to go back to your analysis or your reflections on post-COVID and the surge in injuries that took place, and is that still happening? And has that been an uptick in injuries that has just continued? What the ripple effect has been of sedentary and sitting around and screens, and maybe just talking a little bit about the adolescent, preteen, experience that you're seeing when you have kids and families and parents. I mean, you see it all. You see the whole structure, whether it be a nuclear family or a broken family, or you're having these kids come in and you get exposed to it all. And I'm kind of putting you on the spot a little bit, but tell me a little bit about what are you sensing? What are you feeling? What's happening?
Well, yeah, I think so. COVID was obviously super weird. I mean, we're probably not going to go through anything quite like that again. Most likely not. But hopefully. But it screwed up the normal flow of things in sports, which, some could argue for the better in some cases, probably for the worst in most cases, because kids weren't getting to do the thing they love to do, which does help with the mental health part. And then when you're not socializing and doing all the other normal human stuff that goes with, going to school and doing your sports, that messed things up for sure. I mean, we all know. But injuries were kind of interesting. So we know that kids who got COVID and who were doing pretty elite level, high level sports ended up having, there's going to be a study coming out here in a little bit from us, but it basically showed that at an elite level, if you got COVID, you were more likely to have injuries next than your peers who didn't get COVID. So why that is completely debatable, and we don't know, but we know that the numbers were there that showed that you did have a higher rate of injury afterward. Now, is that because you got forced to sit on your butt for 10 days and do nothing, or was it because the actual virus kind of messed with your body in ways that we don't completely understand, but all the inflammatory processes and stuff added to more muscle strains and aches and things like that? We don't know the answer, but it was different. It clearly was different. But one of the things we saw with COVID that I have seen without COVID, with just kids being sedentary for a long time and then going out for football August 1st. They sit on their butt all summer and then they go out. So we see a lot of those kind of what we would typically call overuse injuries, but they happen pretty darn fast.
Right. So
it's not like that kid was doing a whole bunch of overuse things, but they ended up with the same injury that someone who'd been training for 6 straight months would get. So we kind of saw that after COVID too. And I mean, we didn't really follow it with direct data, but just kind of that anecdotal evidence that seemed to be happening a lot when kids had finally come back from this long hiatus of not being physically active and trying to start it again. But they would try to start back at the level that they had been playing at. Right. And there was a problem with that. They didn't ramp it up. They didn't do that periodization and things to get themselves ready.
Yeah. Right. Yeah. So, I was not with the healthcare system during the pandemic. We had a 4,000 square foot biomechanics lab in California with 2 huge bay doors. And when we had, the different certification services come in to screen for what was appropriate with COVID, we got a number of people that we could have in there. But we were running biomechanical testing. So we'd open these doors and have them come in and out. So, we had a mixed bag. We weren't really doing a lot of direct patient care. We were doing biomechanical profiling of athletes who were some coming off injury, some trying to avoid injury, and they were in and out, So, we didn't really have the same ability to have perspective, on that system. So, can't really speak too much to that. But exactly what you said in terms of ramping up too much too soon, right? I'm the first one who's guilty at where I'm in life of running to get fit, but I'm not fit to run. So, now I'll get bumps and bruises and little aches and pains. And I'm like, oh, I didn't ramp up, But, same thing, regardless of where you are in life, if you're not easing into it and, managing your volume to intensity, those repetitive stress, those things can pop up. And then, like you said, they're at the same place, of someone who's been playing for a while, but they developed a repetitive stress injury maybe for different injuries or for different reasons, right? Yeah.
So going in a little different direction, I want to talk about the mental side of injury. How do you handle a young athlete who's coming in crying because they're hurt and they're going to lose a season? Or, I just had a nephew who fractured his leg going into the goalie, and he was one of the top soccer players in the city, and he's devastated. Yeah. What do you do? What's your role?
Well, first off, I usually count myself lucky that I don't have to give people truly devastating news. Like, that is not something I have to do as a doctor, which a lot of my colleagues do.
Yeah. Especially at
that doesn't mean it's not devastating for the patient. Like, telling somebody they're going to miss 3 months, 9 months, a year is extremely devastating, especially when you've only been living for 14 years. I mean, that's a huge chunk of your life that you're missing.
Like, holy God.
And you've only been aware of it for 11 years. So, so a huge chunk of your life. So I try to be honest. I don't try to sugarcoat it. I try to let patients know, this is what it's going to be from the get-go. If I think there's a chance that they really haven't torn their ACL, I say, we're going to get the MRI. I really don't know. But unfortunately, most of the time after we do our exam and we talk to them, we're pretty darn sure. I mean, 95% of the time, we know what the answer is once we've examined them. So I try to sugarcoat it, try to give them the whole plan at the beginning. I know they're in some stage of grief during that visit. So if it's pretty apparent that it is devastating them, or if it's devastating the parents even, we're going to try to get them set up with one of our mental health professionals at Children's Mercy. Casey Lawless is our PhD psychologist who actually works with our sports medicine department. And that is just a unique resource. I mean, it's nice. It's nice to be at the hospital. I mean, we've got people who can do those things. So we've got that. We used to have Becky Weissman, who was a social worker who worked with us, who did mental health counseling for athletes in Sporting Kansas City. They loved her so much that they took her away from us. Becky's wonderful. She still works with our academy patients and the professionals out there. She is awesome. She is a wonderful resource. Casey is a wonderful resource for us now. But having that ability to give them somebody who's way better at it than I am, walking them through the mental health part of that is very helpful. But it's also important for the parents and the patient to be on the same page. So I think that's sometimes what we see is maybe the patient kind of understands, okay, I'm injured. I'm going to work through this. And the parents over there are devastated, like they've lost their scholarship opportunity or whatever. So having that kind of difference of opinion in the families is difficult. So it's always important. And I think 99% of the parents are completely there for their kids. Very few of them are thinking about themselves. But they might not think about how their reaction is actually affecting their kid too. So that's important. But also just the resources of being able to get back into school. So many times we'll see kids come in where because they hurt their leg, they've been held out of school for 4 or 5 days, which they really don't need to. They can get on their crutches, they can get back in. They need that social interaction. If they're just sitting at home wallowing in their sorrow about their leg, then they're not going to feel good. I mean, getting back in there, talking with your friends, especially, you probably have a friend who had a pretty bad injury somewhere along the line, and they can say, I was out for 3 months. I'm still here. I'm still functioning. I got back to playing. So that kind of stuff is really important. And sometimes we'll see that be a little bit of a problem.
Well, yeah, some of the athletes you've worked with, they've been able to go back and share their story about overcoming serious injuries and finding their way back to the top of their game.
Yeah, I think when the athlete comes over to my side of things, that's one of the things that I've really developed a heightened awareness for. And, in California, when I was there, had a ready list of sports psychologists who could help athletes, work through this challenging time. Like you said, parents, always there, but sometimes you need that professional guidance. And it was really interesting when I was coming up, like, come on, pick yourself up by the bootstraps, you have any real
Tough it out.
Ability to kind of have outlets. And it's something that I really saw athletes use quite effectively. And I think, with some of our guests, you've heard them refer to, those services, which I think are invaluable.
Yeah. So, lucky. That's awesome.
Right.
And Children's Mercy is making a big push on mental health in general. So there's for all youth,
right?
Which is really important. I think that's. I love the fact that the stigma of mental health has kind of gone away in the last 5 or 10 years. We've gotten away from the for better or worse, my dad's generation, the baby boomers pick you up by your bootstraps. Why are you crying? What, all that kind of stuff. I think that's
therapist.
Yeah. I think we're getting beyond that, which is wonderful.
Yeah.
One thing I would do too, Bill, is I had a list of 6 or 7 publications that I had read. I said, well, if athletes could really get something from this coming back from injury. So maybe we could post that, on the website or just list it. And if parents or athletes want access to that, I've really gotten a tremendous amount of feedback from those publications and different.
I'll
books,
include a link in the show notes to that, and then
that'd be great.
we'll be able to post that when we post the show to. Mostly I post it to LinkedIn and then it kind of feeds from there, but we have a Facebook page so we can post it there too. So
sounds great.
I'm trying to slowly but surely build out some sort of, way of distributing this information because it is so valuable. Jay, having you with us is so valuable, and there's so many different things that I think we could do that are part of your background and your, I think we could focus a whole show on girls in sports and some of the issues that they face that are different than what boys face, and especially with the impact of social media on them and the impact of, their body image and the way that their body changes in this time of adolescence. And I know you spent some time in that area. Several other ideas, concussions. We could probably spend a whole show on concussions.
Sure.
The one thing that I've learned a little bit from Doug as I've hung out with him, a little osmosis, but a concussion injury is no different than a knee injury.
Right. Yeah.
And a lot of people don't think that. They just think, oh, you got your bell rung, just go shake it off. And it's not. It's actually a traumatic, kind of like a ligament pull, where you have to just nurse it and you have to baby it a little bit before. And there's been an onset of information, and high schools are paying more attention, and they do baselines. And I think we could spend a whole hour talking about that too. Sure. So,
probably spend a week talking about it.
Right. Some of the other areas that I think are worth talking about are just fractures versus, and we, I showed him an X-ray of the kid's leg that my nephew who got injured, and he said, "Oh, it's so glad it's not, what you say?
Ligament injury.
It's not a ligament injury. A lot of people don't understand that, so we could.
You never want to have an injury, but the young man had a mid-substance fracture, and I said, I'd rather have that rather than an ACL tear. A reconstruction on the knee. So I think you look at maybe what you've been dealt and say, okay, let me control what I can. I know fracture healing is going to be a certain time. Yeah. We can maybe add some things, bone stimulators, things like that to maybe expedite the process. Yeah. But
I tell families when they're so worried about a fracture, I say, the good news is scar tissue for a fracture is just more bone. Scar tissue for a ligament is not quite as good as the original ligament. So
that's right.
There's some ways to look at fractures better.
Yeah, that's exactly right. Well, nutrition. We didn't kind of go down that path. That's a huge deal to preventing and to really becoming the best athlete you can possibly be. The, the, the benefits of sports participation. We talked about that. the role that sports plays in helping adolescents develop resilience and cope with life challenges. Those are things we can cover. I don't want to go too deep into any of these things, but in terms of the advancements in pediatric medicine and sports medicine, what do you think are the biggest things that have happened, and where do you see this thing going? I mean, it just keeps growing, and the importance is more than ever. And so it's your field. Tell us a little about it.
Well, I mean, I think just the idea that there are pediatric trained sports medicine professionals, I mean, that's pretty new in the last 20 years. So if you go to the AMSSM conference, which is actually going on right now, I'm the one who stayed back this year. It's the American Medical Society for Sports Medicine. So huge conference. Most of the people there are in family practice, and they do a wonderful job. They're awesome physicians.
Right.
They're great with adults. They're great with kids. But there's about, I want to say, around 100 fellowships in family practice sports medicine. There's only about 12 in pediatric sports medicine, so it's a pretty finite group, pretty specialized group. And that's one thing. So we have a fellowship program at Children's Mercy, so we're training one of those people every year. And we always wanted to make sure that we had that pediatric specialty. So the people we hire are in pediatrics. They're going to know how to take care of an 8-year-old, a 16-year-old, a 20-year-old, 25-year-old. We learn all the adult stuff during our fellowship as well, but at Children's we kind of make our cutoff college. So we kind of take care of that 10-year-old to 24-year-old is kind of our wheelhouse. But the high school athlete is really what we want to take care of. So I think that in itself is a very big advancement, that there just is a pediatric specialty in sports medicine. But in terms of the real innovative stuff, like figuring out if we can repair an ACL instead of reconstruct it. So currently, if you tear your ACL and you're going to have surgery on it, you're going to get that replaced with a whole different ligament, whole different tendon, taking the place of that old ACL, it's a big surgery. I mean, that's drilling through bone, that's removing pieces of your body and putting other pieces in. But there are people really working on trying to figure out the whole enzyme matrix of the inner knee to figure out if we can get that to actually heal in a way that currently the body won't let it happen. I mean, we think that about maybe 50% of ACLs will actually repair themselves and scar down, but that takes, currently the last thing I read was around 3 years for that to happen. So that's not conducive to an athlete to get back to play. So going through the surgery is really what most people choose. But if there's a way to change that, to sort of, bioengineer the inside of the knee a little bit, people are working on that. And if it happens, that's kind of the holy grail, I think, of ACL. If that happens, that'll be awesome. Right now, it's not working great so far, but I think that's kind of the big thing that's on the horizon.
Interesting.
Is some stuff like that. So, meniscus replacement, being able to not remove the meniscus, and that's something that people in the 80s who they tore their meniscus, they just took it all out.
Yeah, right out.
No one does that anymore. That is, they try to save as much of the meniscus as possible. So things like that are really helpful. Same kind of the labrum and the shoulder and the hip, trying to preserve as much of that as possible. It's cartilage, it's a shock absorber. Cartilage doesn't heal well. Cartilage, if you remove it, it's not coming back. Your body's not growing new cartilage. So those are the things that I think have been big over the last 10, 15, 20 years.
Right. I think from my perspective, we talked about it, so many times in different facets of what we were addressing here, Bill. But, for me, operating with an instrumented process, gaining objective data on an athlete to show them, hey, you've sustained this injury, or towards, the latter stages of, the third year of our lab in California, we're doing a lot of preventative assessments, but giving them the objective data to understand their overall efficiency, what the athlete's load capacity is, their structural integrity, I think is the biggest advancement for the way I practiced it, to the point where I really can't practice without that type of instrumentation. We're talking about, surface and fine wire EMG, to see just what outputs are coming out of the musculature. A dynamometer, it's research grade, you can, assess concentric and eccentric strength and get those numbers, but then you can also take the athlete and train them on that. And then you could mirror that with functional isoinertial wheel technology, which simulates eccentric load. And the reason I'm mentioning that is, all injury happens in eccentric load, right? So, decelerating, cocking the arm back at the UCL, decelerating the arm with rotator cuff injury, and then having instrumented processes for assessing running, where we have a treadmill that could capture 3,000 points of data every time the foot hits the belt. And when you stereoize that with a motion capture system, you can really dial in and give them feedback and work on remodeling some of their movement tendencies with a high degree of efficiency. So
when you hear
I
all
agree,
that,
that's also a great innovation. Yeah, it's wonderful. It's awesome.
When you hear all that, that's cool stuff, huh?
Very cool stuff.
'Cause it's way above my head.
Yeah.
I'm just like,
well, and the idea, like you said, about that sort of injury prevention, get them before they even get hurt.
Right.
So get them in there, find out what's going on, keep them from. So ACL injury prevention programs, not as sophisticated as all that, just general,
Right.
but we know that they help.
Right.
I mean, if you aren't doing them, if you have a team of 12-year-old females playing soccer and you're not doing some ACL injury prevention warm-up, you're doing a disservice to your team.
I probably say it every show, but I go back to what Bobby Stroop does with Patrick Mahomes in his gym, and it's unbelievable.
Yeah.
And he puts his body through it all. And that's why when you see Patrick get injured, get tackled and his leg gets bent in a funky way, you're like, that would injure most athletes, and it doesn't him. So whatever. But
we actually
Genetics help too.
genetics, yeah.
we just wrapped a study in California looking at an elite girls club team, and we performed a biomechanical profile with them, strength, running, slow moving, fast moving challenges to the nervous system, and then we took that data from these two teams, and we tracked the highest areas of deficiency. And then we built a specialized warm-up before their practice, and we periodized it. So we worked through all the boxes we needed to check, somatosensory-based, proprioceptive work, nervous system-based engagement, mechanical-based load principles to make sure that they were loading in a correct fashion at slow speed, high speed. And then we retested them at the end. And the outcome data on that was just phenomenal. And I didn't mention this to you, Jay, but we're presenting that data, the outcome, at FIFA conference in Spain in next month in May. So, upwards of
Very
a 20%, change in mechanical efficiency. And then we dropped the injury rate from mid-20s down to 4 in a significant injury classification. So, it goes to the point saying that things can be put in place that really help athletes do what they want to do and have more fun, be with their friends. And, it doesn't take $1 million technology lab as long as you're inputting some things there that have some basis behind them that can help that process. So.
Well, you talked about doing some videos to help kids at home do physical activity, exercise, kind of do the talk. Let's close with this whole discussion about this, just kind of what you're working on with that, because to summarize this conversation, movement is the medicine. I mean, we're talking about injury, but we're also talking about prevention of injury through physical activity and exercise, and doing the right things at the right time for the right reasons. And so, talk a little bit about what you're trying to get done.
Yeah. So that part, kind of just ignoring the sport half of it, just the movement part of it. We want to give parents and educators some resources, just simple little resources. We're calling them brain break videos. At least that's for now what we're calling them. We haven't made them yet. But our goal is to get, maybe a celebrity athlete in Kansas City, preferably, since it's going to be kind of a regional thing.
Sure.
Get one of our physical therapists to kind of run some exercises, just a little 10-minute thing that a teacher could just flip on in the class and say, everybody, let's get the wiggles out. Let's move. Let's do something.
That's great.
Do some legs, do some arms, do some core, something like that. Have a couple of kids in the videos. Also make some modifications for kids who are differently abled. So kids who might be in a wheelchair, who have a prosthetic leg or something like that. Have some kids in the video who can show those kids like them different ways to do it. So they can still get the benefits of that with little modifications. So that is That is a goal of mine.
I love it.
See.
Well, we'd
see
love
if
to
it
be
goes.
involved.
Yeah.
I would personally love to be involved in the production of that and help think through how we promote it and make it something that is useful for parents because, really, I kind of, all this whole thing, it kind of gets down to the fact that parents are the target. Parents, kind of lead the way for their kids. They can either put the pressure on them and force them in and make them, do things that they're not supposed to be doing, or they can make sure that they're, being informed with how the right way to do things, the right time, and the right.
Right. It's really interesting you say that, like, the parent kind of really, leading the way, right? And that's as it should be. But I had a really interesting experience. My daughter does gymnastics, and she's practicing headstands. And I was like, well, wow, it's been about 30 years since
I've done a headstand.
Yeah.
I don't think I can do a
life.
headstand.
Let me practice, right? So one day, it was just one day, where I have the wall, I have a tripod, I'm on my hands and knees, and I get up my knees on my elbows, and I push up into a handstand. It's like a tripod, my head and a hand. And my kids did that, right? And then they're training me. They're like, no, Daddy, use the wall next. Like they're 8 and 10. Like, okay, I might put a hole through the wall, but like them coaching me to do a better handstand. Yeah. And just getting that engagement with my kids, I was like, wow, that was really effective. And we're using that now in like little different ways to have activity time, So,
well, that's good.
Well, we had those 3 young people come and talk at the Aspen Institute meeting last week, and they were phenomenal. Like, all those kids should be in charge of something in their life.
No
Run
doubt.
for office, presidents, I don't know. But they all kind of said the same thing. They wanted their parents to listen to them and then help them how they wanted to be helped. So that was really important. I thought that was a big takeaway is don't think you know what the right answer for your kid is. Talk to them. Ask them what they want. Do they want you to be a little pushy after a game with them, or do they want you to just let them sit in peace if they lost or whatever? So
Exactly
I think that's important too.
Our kids can help be our guides for sure. Well, you listen to music. I'm ready to listen to some music. We like to move it. I was a DJ of the Fit-tastic Kids Zone on Friday, and I just danced, and I could barely move afterwards. This is Movement is the Medicine, our podcast that helps reinforce the power of movement in our lives to make us healthier, happier, and live more fulfilled. It's really generated around the idea that we need to get our kids more physically active, get them engaged with their friends, playing outside. Free play is good for kids. Make it happen. Really appreciate everybody joining us today. We will be back with another episode, and we just hope you continue to tune in to Movement is the Medicine and learn more about how movement can change your life. Thanks.
Excellent. Thank you.